spread primarily in two ways. One, if someone is severely ill and cared for in a hospital or at home and has the caregivers or healthcare workers have contact with the body fluids. That's the first way. The second way in Africa is burial practices where people may be exposed to body fluids from someone who has died.
So Dr. Siegel, Dr. Brantley, we're told is getting better. Can he fully recover from this? What is Ebola and how do we prevent possible spread?
First of all, Eric, the idea that he walked into the hospital is a tremendous sign, and every public health expert in the country is saying that. We don't know the specifics, but Ebola can really knock you down, because the way Ebola works is it eludes the immune system. You don't get the usual immune response you get for another virus like a cold. The antibodies are not responding. If you get very sick, it's because Ebola is going all over the body. It can affect the kidney, the liver. Now, the initial signs of it, the symptoms you get first, are just like a flu, and that's why it's hard to diagnose. And both Dr. Frieden, who I spoke to, and Dr. Tony Fauci, who I spoke to, who's a top infectious disease guy in the country, both said that you're not going to spread Ebola unless you already got symptoms from it. Symptoms, though, first are flu-like symptoms. Basically, you have a headache, you have muscle aches, you have tremendous fatigue, you have a high fever, then you get nausea and vomiting, and then after that you can get plenty of bleeding, which is one of the things that leads to the death of patients with it. Over 60% of patients are dying from this particular outbreak. He probably got very good supportive care over there in Africa. Plus, he got blood from someone who had already survived it. So it's possible that the antibodies he got actually helped him.
That's amazing. They say that was a 14-year-old boy who was infected with Ebola, and he got a blood transfusion from that young man that basically possibly saved his life. Because you saw that video of him walking in. It was unbelievable, walking out of the ambulance in that kind of decontamination suit. There it is. There's Dr. Brantley on the left. And when you see this, as you mentioned, what does this mean when you see him not on a stretcher, but actually under his own power, able to walk in and then reportedly talk to his wife?
I think it's incredible. And by the way, one of the things that Dr. Fauci underlined that I want to show here is how much of a hero this guy is. Dr. Brantley goes to a country like countries in West Africa and is a missionary there, and he's working to save lives. And so we, in a way, owe him our taking care of him. And in this unit that the CDC is overseeing, in Atlanta at Emory Hospital, we're able to isolate him, study the Ebola virus, figure out how to treat it in others. Let's watch what Dr. Fauci said about this.
I think they're very courageous. They're people to be admired. They take their job and their oath as a physician and a healer and a healthcare provider to take care of people even under extraordinary circumstances. You know, we had that kind of experience, myself personally, in the very early years of the HIV/AIDS pandemic, when we were taking care of patients, when we had no idea what this was, how it was transmitted, or anything like that. It's what you do. It's your job as a physician.
So he said that the trouble is going to be to control it in West Africa. Populated areas that are porous borders and very poor healthcare infrastructure and all kinds of voodoo things like washing dead bodies. That's one of the reasons it spreads there and won't spread here.
You know, it's amazing. They're right. Such a noble cause going over there and being an American doctor and treating the people who have this deadly virus. Dr. Samadi, should we worry here in this country?
Well, the reason why we got so many emails and Americans are really concerned about this, Eric, is because we have a second doctor that's going to come probably Monday morning. So we would have a second case of live Ebola virus in American soil, and that makes a lot of people uncomfortable. We also have Patrick Sawyer, who was an American person, the third one, who actually died 2 days ago in Nigeria. That's the third American who actually passed away from this. And you have a doctor in Tennessee, Alan Jamison, who's a retired pediatrician, who is on household almost quarantine because he doesn't want to expose himself. For the next 3 weeks, he's not going to leave his home. So we have Ebola virus now in the U.S., and that increases a lot of concern. Now, this is a major outbreak because if you look at Ebola, since 1967, we've had 23 people die. Just recently, we've had 700 in West...
You mean a major outbreak in West Africa?
In West Africa. So we have 700 people who have died over there. Americans are concerned because we have no cure, no vaccine, and it's lethal. The answer to your question, should they be worried? Absolutely not at this point. The reason is because our healthcare system can manage this. Even though the world has become global, people are traveling from other countries, they can bring this. We can find it, we can contain it, we can isolate and treat it very accurately. So I don't want people to really panic as a result of this. Obviously, Emory is a great hospital. They have 4 centers that can take care of this. CDC is 100% behind this. And of course, finding if anyone has fever that has traveled to Africa, the next question is we should take that person in the hospitals and isolate them so we cut down the aggressiveness.
I think a lot of concerns are also human error. I mean, you cannot guarantee that one doctor could potentially make a slip up. Doctors are not perfect.
That's true.
Let's agree. So people are worried about human error, possible transmission that way, and also security risks, because this could be potentially used as a weapon.
What we saw not too long ago,
if in the wrong hands.
Julie, your point is absolutely well taken. Actually, Ebola is also known as a biological weapon.
Correct.
And what it does, the virus comes into your system, takes over the immune system, then starts traveling to all the other organs, kidneys, liver. And what it does, it basically makes organ failure. It causes clotting, Eric, in the blood vessels, but it causes massive bleeding, all around your body, and you can die. So it's true. It's a biological weapon. The government is looking into this, but we just had a recent mistake at CDC where they send a live virus from one lab to another one.
Well, that's the exact reason that I bring this up. We're going to have to take a quick commercial break, but we will go into that more because the CDC is not perfect either. So it's not just human error, it's the CDC. And if the CDC has made errors in the past, people worry perhaps they'll do it again. And with this, there is no room for mistakes. You guys stand by. We've got more on this coming up. Weighing the risks of a possible Ebola outbreak here in the United States. Should you be concerned? We are getting a flood of your Twitter questions. So the doctors weigh in on those next. You can tweet us at Julie Banderas and at Eric Sean on Fox. We'll read some of your concerns to the doctors right after the break.
Now, let's see if I can convert this.